Okay, and where's my, oh, here we go. Okay. And we can go ahead and get started.
All right, we're just going to hang on for just a few minutes and let everyone join the webinar before we get started. So we'll just be 2 or 3 more minutes. All right, it looks like most everyone has joined us. We wanted to thank you for joining us this afternoon. We are so excited to be telling you today about the Chamber Choice Health Program. My name is Becky Bartosik. I'm the President and CEO of the Fox Cities Chamber. Tanya, you want to go to the next screen for me? We actually have been working with Network Health and Robin Partners quite a bit over the past 18 months, trying to put together a program that we felt would be very attractive for everyone. As you will see, historically, the Fox Cities Chamber actually had a very successful insurance program in the past. And legislation had changed and that program went away over the years, and we knew that it was a vital portion of business expense. Tanya, let's look at that next screen quickly. As we go through the discussion today, I will touch on just the brief introduction. Network Health will go next. After Network Health, Robin will cover all of their information as well. Because this program is a chamber employee program or chamber member program, we will cover the different tiers and programs that are available through the chamber, and then we will handle questions and answers at the very end. And we will try to get through as many as we possibly can, but with over 100 attendees today, we may end up following up with additional FAQs as well as providing additional information. So part of the reason why this was such a big focus for the chamber is when we look at all of the things that are impacting our members, employer expenses obviously are an area that we always hope to be able to find solutions. And when you look at the amount of expense that an employer has, if you look at the 2018 numbers, 7.5% goes into employee health insurance. So we want to make sure that if there's an opportunity to provide additional options as well for high quality insurance offerings, we wanted to explore that option. We will go into that in much greater detail with the actual members, but because we have brokers on the line today, this is information that you already know. So Tanya, let's flip to the next screen. So as we mentioned, the Fox Cities Chamber has been working with a number of partners over the last 18 months to come up with different solutions. I can honestly tell you, we were thrilled when Network Health and Robin came to us and actually said, we are willing to partner to put together this dual choice option. And what's exciting about this is that we have Network Health, who is affiliated with Ascension, and Robin, who is affiliated with Data Care, and they have agreed to work hand in hand with the Chamber of Commerce to put together a program that actually gives the options to select your network right down to the employee level. And that's what we believe you will find the most intriguing today. So Tanya, let's go to the next screen. So to really get to the heart of the matter, let's go over to Travis with Network Health to really get us started.
Perfect. Thank you, Becky, and everyone at the Fox Cities Chamber. My name is Travis Jansen. I'm a senior account executive here at Network Health. I, of course, wanted to thank all of you who are joining us today on this exciting, very exciting call. We understand the importance of our agent partners, so that is why we wanted to share this very exciting and unique program with all of you first. All of us at Network Health are extremely excited to be able to provide another option for our agent partners and your clients. Now more than ever, businesses in the community are looking for ways to save money and have rate stability. The timing of this rollout couldn't have been more perfect. You will now be able to provide, like Becky said, an option of 2 provider-owned carriers at once. One of which has been in Wisconsin based and serving the Fox Cities community for almost 40 years. At Network Health, we are your hometown advantage plan. Next slide, please. From our headquarters in Menasha to our office in Brookfield, we work to meet the needs of our members throughout Wisconsin. As most of you already know, if you're looking for the largest, most widespread health plan in the country, that's not us. However, if you're looking for informed people you can reach in person or locally on the phone who answer your questions directly, speak your language, that's us. As most of you already know, we take a different approach to health insurance and provide personalized services and treat you with the courtesy and respect you deserve. Being local has provided us many advantages here in the community. It allows us to focus on our mission to create healthy and strong Wisconsin communities. At Network Health, we care about making our home a better place. We reinvest in the community by volunteering, sponsoring, hosting events, and donating to local charities. So when the opportunity to partner with the Fox Cities Chamber had come up and create a unique partnership to help businesses in the community, this was an easy decision for us, and we of course jumped right at it. With the partnership of the Fox Cities Chamber and Robin HealthPartners, we are excited to introduce the Fox Cities Chamber Choice. We have created a unique and exclusive group option for you to offer your clients. You will now be able to offer your clients a dual choice of 2 different provider-owned carriers and let the employees choose which option they would like. So, for example, if you own ABC Company in Appleton with 30 employees, and you would like to offer a dual choice to those employees, you can now do so. And let the employees pick which carrier they would like to select, with no minimum participation from each carrier. So out of those 30 employees, if 20 of them want to select Network Health and the other 10 want to select Robin, they do and they can now do so with this program. The group would simply receive an invoice reflecting the employees that enroll from each carrier. And then each carrier would then provide a separate renewal upon the renewal time, reflecting the total of number of employees that had enrolled. For almost 40 years, we have transformed our industry collaborating with the highest quality healthcare providers to deliver innovative health plan solutions that provide exceptional value to our customers. Network Health is unique in the fact that we are locally owned by Freighter Health and Ascension, Wisconsin. We collaborate with our provider owners to give our members access to high quality, coordinated care at some of the highest discounts in the area. Our members have access to more than 2,000 primary care providers, more than 12,500 specialists, and 50 hospitals throughout our 23 county service area. Next slide. By being provider owned, we offer fully integrated provider network and deep discounts. Ascension Northeast Wisconsin is committed to delivering high quality, cost effective care while continuing to be the only 4-star hospital in the Fox Valley. The Fox Cities Chamber members will have access to quality, affordable hospital care in all of the 3 counties they serve: Outagamie, Winnebago, and Calumet. With over 14,200 specialists in our network, we give our members access to the best specialists in the state. In this area alone, we've got some of the best: Primary Cares of Appleton, Kaukauna Clinic, Family Care of the Fox Valley, Heart and Vascular, Neurospine, Orthopedic Sports Institute, Heart and Vascular, and Smart Choice MRI, just to name a few. We also have a unique partnership with Novo that provides our members with the lowest bundling price and service guarantees in the Fox Cities market. Through our partnership with Express Scripts, members have access to an extensive pharmacy network. Members have access to all the big box stores such as Walgreens, Myers, Sam's Club, Walmart, Costco, and Pick and Save. This also includes locally owned independent pharmacies. So all of our members have the convenience of the pharmacy near them, near their homes, and as well as their workplace. Our pharmacy benefit managers work with Network Health to provide innovative and accessible prescription benefits while keeping the cost low. We also do provide a 90-day prescription drug mail order program. Members will also have access to many unique online tools such as mobile apps to confirm or refill prescription drugs on the go. We've got search tools to get directions to some of the in-network pharmacists, as well as we have a very unique Ask a Pharmacy messaging service to get confidential and reliable answers to your prescription drug questions. With the continued increased need and cost for insulin, in 2020, Network Health found a way to deliver insulin to our members at a discount rate by creating the Patient Assurance Program. For as little as $25, for as little as a $25 copay, members have access to many Tier 3 preferred insulin drugs, such as Novolog and Novolin. Our Fox Cities Chamber members will automatically be enrolled in this program. We understand that most of the high-cost claims are coming from prescription drugs. Due to that, our in-house pharmacists are continuing to look at creative ways such as this to help our members in a way to keep costs down. Employees that select Network Health through the Fox Cities Chamber program will also have access to 3 Ascension Nearsite Clinics placed strategically throughout the Fox Valley area. One on the north side and south side of Appleton, and another in downtown Neenah. With membership growth, we have the option of expanding this to several other clinics nearby. At these clinics, members will have the opportunity to enjoy an extensive list of both acute care and wellness benefits throughout our co-choice copay plan at a $0 cost. For those on an HSA plan, they will receive these services on a discounted basis. For those who choose Network Health when they enroll, they will receive a custom membership card that they will just simply present at the front desk upon their arrival to gain access to these 3 clinics and the services listed. Some of the treatments are ear infections, immunizations, sprains, cuts, annual wellness visits, and sports physicals, just to name a few. These clinics will be open and available to the Fox Cities Chamber members effective July 1st. Including the availability of the 3 Nearsite Clinics, Network Health members will have access to many of the other unique value adds. A wellness program, telemedicine benefits, which I'll go over in a second. They'll also receive they'll continue to have the availability of adding a free vision exam by seeing one of the in-network providers. They will also have access to material and LASIK discount program that we have currently through IMED. For 2020, we have added an extensive $0 Smart Choice prescription drug list. We have also given out our direct number to our in-house pharmacists for members who have questions on prescription drugs. Our concierge service is here to help anyone that needs help navigating the extensive network of providers or needs help with any of the transition of care as well. With over 10 plus combined years of experience at Network Health, both our members and groups will have a direct, dedicated access to one of our experienced client managers, regardless of the group size. They are your direct access to anything from billing questions, helping with implementation, adding new employees, renewals, and much, much more. I know for the agents that are on this call, I know most of you have worked with many of these and understand that they are all rock stars in what they do in the services that they provide. So MD Live, Network Health members also have access to virtual online doctor visits through MD Live. By using their phones, smartphones, tablets, computers, they will now have the ability to get in touch with a board certified physician or pediatrician to help with anything from a wide range of non-emergency type services. We also have access to behavioral health to help out with any of those conditions as well. Because they are board certified physicians, they also have the ability to fill prescription drugs as well. Virtual visits offered through most network healths are designed as an alternative to personal doctors, urgent cares, typically for those non-emergency type conditions. Depending on which program you select, in most cases, this is actually going to be a $0 copay. And for the HSA plans, a small contracted cost. As you have heard in the media, now more than ever, telemedicine has grown very popular as well. And we've definitely seen an increase in the services that we've seen here at Network Health as well. Wellness programs. We understand that when employees participate in a wellness program, this typically leads to better health screen results. That means lower blood pressure, cholesterol, and less tobacco use. Better health means fewer claims, which means lower overall care costs. That is why we have included a wellness program regardless of your size. Participants will have access to wellness tools, resources, including a health resource assessment, as well as learning modules with this program. Everyone that signs up will receive a Fitbit pedometer to help monitor their activity towards a healthy lifestyle. We will also be giving out you will be able to receive up to $250 in Visa gift card rewards through the program as well. So you've all probably been asking yourself, how does the program work? And what group sizes are eligible? When can I get quoting for this program as well? We are excited to announce that starting today, you'll have the opportunity to quote small group level funded plans and both mid and large group fully insured plans with an effective date of 7/1 or later. The program will allow you to go down to as low as 2 enrolled, and for the larger group clients, over 100 plus enrolled employees. Once again, allowing the employees to choose. So for groups that have 2 to 9 initially enrolled, Network Health will be the exclusive option for your chamber groups. Groups will still have the luxury of taking advantage of all the value adds, including the access to the 3 Nearsite Clinics right away on July 1st, while having the option of offering your groups both our HMO and point of service small group assured level plans. So for example, if you're a group with 15 eligible and 2 to 9 enroll, they would be an exclusive option only through Network Health. Groups of 10 to 50 enrolled will have access to both carriers, small group level funded platform. Groups with 10 or more initially enrolled opens the access to offering both Network Health and Robin on an employee choice basis. So for example, if you have a group of 20 eligible and 15 enroll, this would be an opportunity for a dual choice option with Network Health and Robin HealthPartners. Out of those 15 enrolling, each employee will then select either Network Health or Robin HealthPartners as their individual carrier. Groups with 51 to 100 at-need will also have access to the employee choice program on the fully insured platform, as well as 101 plus enrolled in size. So why level funding? Why do we keep talking about the small group space? Well, we believe small groups are looking for something unique right now, new and exciting for their employees, while at the same time allowing them to save premium dollars. Unfortunately, small groups can be underserved and don't always know their options in the marketplace. Many small groups think level funding can be complicated, risky, and really meant for larger groups. What they don't realize is fully funded ACA health plans can sometimes be more expensive for small businesses. Many healthy groups are now turning to level funded health plans, which blend the economic advantage of self-funding and the financial predictability of fully funded plans. As you know, there are many advantages to the network health level funded plans, such as 100% refund of the claim surplus, no health insurance tax, and the opportunity to save money off of the current plan. Here at Network Health, we are consistently seeing anywhere between 10 to 30% in annual savings on our level funded plan. We're happy to say that the Fox Cities Chamber Group was willing to be one of our first pilot groups for this program. After going through the underwriting process, we were actually able to save them up to 17% off of their current ACA rate. So where can I go after this call for more information? We at Network Health and the marketing department have created a dedicated library of resources. You can find all the information you need to learn more about the program, as well as marketing materials to share with your clients by simply going to networkhealth.com/chamberchoice. There you will also find underwriting requirements needed for your submission based off of the group size that you want to submit. Once the group is sold, the implementation of paperwork on our small group level funded will be 100% automated for you and your clients, allowing paperwork to be completed online via DocuSign. We created a dedicated place to send your submissions to fcchamberchoice@networkhealth.com as well. Commissions. We understand that even small groups require a lot of attention and service. So because of that, we will continue to pay our agents 2 to 3 times more in commission than the industry average on our Assure level funded plan. We will pay $60 per employee per month for the first year, and then $45 per employee per month years after that. So as you can see, Network Health has put together all the tools and resources needed to make this new and exciting benefit for your clients. We will continue to provide your clients with access to outstanding care and personal attention. We are and will continue to be your hometown advantage. So with that, I'm going to pass it over to Lori DeSorsi over at Robin HealthPartners to share a little bit about what they have to offer over there.
Thank you, Travis. Who'd have thought we'd be sitting here next to each other?
I know, agreed.
Thank you so much. You did a great job going over the program guidelines and everything, and I'm going to do my best to offer similar information about our program in the context of the Chamber Choice offering. So again, thank you for having us here today, and thank you all so much for attending today. I'm going to kick it off with talking about who is Robin and why are we here, because admittedly we are the new player in town. Simply put, Robin is a collaborative venture health plan founded in 2017 between ThedaCare, Bellin, and HealthPartners. ThedaCare and Bellin, our local hospital systems, invited HealthPartners of Bloomington, Minnesota into Northeast Wisconsin to be their healthcare financing partner and to create an integrated healthcare delivery system here. The fact that these organizations are culturally aligned and all function on the same electronic records platform enables Robin to achieve the 3 objectives common to all 3 organizations. These 3 objectives are making care affordable, enhancing the member experience, and improving health. So while all of you know our hospital systems, because we all live and work here, you may not know a lot about the HealthPartners organization itself. HealthPartners is the largest consumer-governed nonprofit healthcare organization in the nation. We own over 90 hospitals and clinics. We employ 26,000 employees in our Bloomington, Minnesota office. We care for over 1.2 million members and insure 1.8 million members. We've been in the business for over 60 years, offering medical and dental products, worksite services, pharmacy services, and health and well-being products. In addition, HealthPartners owns its own research facility, the HealthPartners Institute, dedicated to identifying better ways to treat illness and improve services to our members. Next slide, please. HealthPartners in Minnesota has a proven track record for exceptional quality and consumer satisfaction. We were the top-rated commercial health plan in Minnesota for 2017-18. We've been in the nation's top 10% in more quality measures than our competitors in Minnesota for the past 12 years. And we have the highest overall consumer satisfaction rating among Minnesota health plans for the past 11 years. While certainly those statistics are specific to Minnesota, we bring all of this experience and expertise with us into the Northeast Wisconsin market. Go ahead. We'll dedicate the next few slides to a brief discussion intended to support how we make care affordable, our first triple-aim objective. As many of you already know, Robin with HealthPartners offers 2 networks in Northeast Wisconsin today. We offer a broad network option and a focused network option. The network option we bring to this unique chamber choice offering is the one that features our best discounts and therefore our best pricing, the Robin Focused Network option. We used this slide, as small as the print may be, to try and depict who is in our focused network and how to search for providers on the web. Since we can't possibly list every provider in our network on a single slide, we list here the major provider systems, as well as a few of the more well-known independent practice clinics. As noted, you'll see the Bellin Health System in Green Bay, the Theta Care System and all its clinic locations here, the Aurora Healthcare System, as well as Holy Family along the lakeshore. On the left part of the slide, we pointed out just a couple of our independent practices that are part of our plan and wanted to make sure you were aware of those as well. We are not an organization partnering with just our anchor hospitals, but we have other providers in our focus network as well. Coverage is available to all providers on our POS plan designs. Care received from providers that are in network is paid at the highest level. Care received from other providers is payable, but at the lower out-of-network benefit level. Okay, so while we in the Northeast Wisconsin area have the great fortune of having great care options inside our Robin service area pictured here, we realize that we sometimes have special needs for higher levels of care, or tertiary care as we call it, from providers outside of our area. We also often have children living outside the area and sometimes need or want to travel to other areas of the country. Maybe not now, but hopefully in the near future. For this reason, HealthPartners contracts with Cigna for access to its largest network of national providers throughout the country. Services from these providers listed at the bottom of this screen are considered in-network and payable at the highest level on our Robin Focused Network plans. We are truly a local plan with a national reach. Now it's time to look beyond our network of providers and learn a little bit about how Robin brings a better member experience to the Northeast Wisconsin marketplace. There are some ways we achieve our second objective of triple aim yet to come. First, our personalized resources for members. HealthPartners member services team are truly best in class. Our staff includes a multidisciplinary team of professionals ready to serve. Our frontline member service staff are ready to answer questions about providers, benefits, claims, and eligibility. When they're working with someone that might benefit from assistance with complex care issues, care coordination, guidance, or simply support, our frontline staff can readily transfer calls to a nurse navigator. If callers are looking for help with mental health care or alcohol and drug abuse services, they can engage a behavioral health navigator to assist them in finding care, understanding benefits, and accessing services. Finally, members can ask questions of our pharmacy navigators for help with formulary issues, medication management, or to help them just identify more affordable prescription options. All of our member service staff are true advocates, ready to reach out to provider offices for billing issues, and are assist members in getting the information they need and the services that they need. You'll note on the bottom, I've added, go back there, please. I've added a couple of notes. All our member service staff are located in our HealthPartners offices in Minnesota. None are offshore, none are outside of our country. And they never close a call without first offering their first name and their direct dial phone number. Members are free to make any member service rep their personal member service rep if they so desire. That service offers people confidence and peace of mind. So, tools, website tools. Members can find assistance online by using our cost comparison tools, medical and pharmacy. We offer them the opportunity to search and compare pricing for these services, as well as help find information about their own history in terms of their prescription history online. This slide features a screenshot of our pharmacy transparency tool. This tool was designed much like GoodRx, which many of us in this market are familiar with. It's a price comparison tool, except our tool is customized to reflect our plan design and member-specific details. As you can see, members can look up lowest cost pharmacies, they can compare costs, they can transfer medications, look up the drug itself and find different options for different drugs. So these are important pieces of information that members can access even without the help of member services, but member services is there to help as well. One unique thing about our tool is that it also allows members to compare mail order pricing. We do offer mail order services, and the mail order pricing is presented right on the slide, right next to the retail pricing for their convenience. Virtual care and telemedicine options. To further assist members in getting the care they need for some of the more acute illnesses and injuries, we offer two different services, Virtual and Doctor on Demand. Virtual is actually a product of HealthPartners. We built it. It's essentially an online questionnaire and exchange with a nurse practitioner. It's easy, fast, and guaranteed. And as you'll note on the bottom of my slide, repeat visits to Virtual are free. Doctor on Demand is a clinic system, an online clinic. The difference here is obviously that the Doctor on Demand service is more of a video chat or a FaceTime-like experience with a physician. Members have to download the Doctor on Demand app, and visits are never more than $59. So those are two additional options. Personal service and web and mobile tools. While members can certainly feel free to call member services and ask any question they wish, they also have the opportunity to look online at myhp.com or to use their phones and download the MyHP app. The same experience is available on either the app or the desktop. It allows members to pull up their ID card, look up claims, look up benefits. It also, of course, includes those pharmacy transparency tools and the medical cost comparison tools that I mentioned earlier. We also offer an online health risk assessment and an array of digital and health and well-being tools and resources available either by laptop or phone. So those tools are certainly available. So everything we've talked about thus far has been about how we achieve our triple aim. We talked about our provider network and affordability and our member services, our member resources, and enhancing the member experience. Ultimately, however, it's all got to be about improving health. That's really the end game objective. We all know that engaged members are healthier members, and healthier members drive lower costs. This slide could be a full presentation in and of itself, and I realize it's a little busy, but I'm going to sum it up for you. It highlights what we at HealthPartners do differently. Our work is member-centric, focused around our members. We take the information we collect from our members, their preferences, their demographics, Epic system data on conditions and treatment, and we use research to find the best ways to reach out to them, whether it be phone or text or email. We do whatever it takes to get a response. Once we reach them, we educate them, we engage them, we work with them on their treatment plans to get them activated. But we don't stop, we stay close to our members throughout all stages of their health. Our nurses help members manage complex conditions to ensure that they continue to move along the continuum to better health. Healthy discounts. For those members who have interest in using gym facilities to take better care of their bodies, we offer 2 different discount programs. Membership discount programs through Global Fit and Active Fit, national fitness organizations. In addition, members can access discounts on services and supplies typically not covered by medical plans by clicking on the Healthy Discounts link on our website. By entering their zip code and the service they're interested in, they'll find a multitude of providers in our area that offer discounts to Robin with HealthPartners members. So, how does the Chamber Choice Plan work? As Travis mentioned, it offers maximum employee choice and flexibility down to the employer level. We also are quoting now, first available effective dates are for 7/1. Groups must be Fox Cities Chamber member groups. Brokers must be or be willing to become a Fox Cities Chamber member to enroll a group. Robin will provide level-funded proposals for groups of 10 plus eligible lives and a minimum of 10 enrolled at the time of quoting. This is a modification to our standard protocol because normally HealthPartners does not quote groups for level-funded plans below 20 eligible. So this is a change, and this is only available through the Chamber Choice Program. Robin will provide fully insured proposals for all groups of 51 plus eligible lives. So this slide just presents some highlights of the features of our level-funded products. Obviously, cash flow certainty, similar to a fully insured plan. The fees that we build in include administrative stop loss, claims, and broker comp fees. We are the claims fiduciary. 80% of the surplus premium is returned at settlement if a group renews. And we use 1218 contracts, 110 ag attachment points, and a $30,000 spec stop loss. In terms of our portfolio of plans, we have over 58 plans available, ranging from copay plans to HSA copay plans, and throughout that continuum presented. We use our Generics Advantage formulary. All preventive care is covered at 100%, including routine eye exams on all our plans. We offer unlimited visits at no cost for Virtual, and out-of-network services are covered on our POS plans at 50% after deductible. So these are just some highlights. The next slide is simply a clip of the face page of our product grid. It's about a 5-page document available on our broker website. And I just wanted to give you a picture of it here so that when you see it, you can identify it quickly. The next slide talks a little bit about implementation. We all know that there's more paperwork when it comes to level funded products. Our implementation documents include the 5 documents that are listed there, as well as, of course, an ASA agreement and summary plan description documents. We'll need to work with you on implementation once a group is sold. In terms of the 51 plus space then, we have, again, 58 plans available. And what you see on this slide, for those of you who are watching carefully, is exactly the same as what you saw on the slide for the level funded products. The features of our plans are mirror each other. The naming conventions may vary, but they look pretty much the same. We're trying to keep things simple. This, again, is a snapshot of the product grid that is out online for our 51 plus eligible EZ portfolio. So how to get a quote. What you see on this page is a summary of our submission requirements for Robin. We urge you to print off a copy of our submission prerequisites available in the forms section of our broker portal. You'll note on this grid that we will use health history underwriting for all group sizes 10 to 50 and GRX, or we call it curve, for group sizes 51 plus. The requirements here are fairly standard for both of these underwriting methodologies. Be sure when you submit your quote to indicate that you're looking for a quote under the Chamber Choice Program. You'll want to specify your plan designs using the plan grids I just showed, and make sure that you submit your request using the email address here. You don't have to write it down. It is all on all of our submission documents out on our broker portal. Finally, broker comp. Our broker comp for our level funded plans is set at $27.50 per employee per month. We offer a variable PEPM or percent of premium for any cases 51 and up. You just need to tell us what to build into our quotes for those size groups. So with that, the next step, if you aren't already a Robin broker, please become contracted. That enables you to access the broker portal and see all the materials that I've referenced today. Simply contact myself or my colleague, Cher Fuller, who's our sales representative for small groups. If you switch to the next slide, our contact information is there. We're eager and looking forward to working with you and helping you to understand this program and obtain the quotes that you need. Thank you again for listening so quietly here today. And I'll turn it over to the Chamber to facilitate any questions. Thank you.
Thank you, Lori. So as we mentioned before, the Fox Cities Chamber program is a member program where we have broker members selling to chamber members. It's exclusively available under those premises. But it was also very important to Robin and especially to Network that brokers have the opportunity to actually get a quote through the Chamber Choice Health Program prior to becoming members, so that they have the opportunity to actually go through the experience and get some real world experience with the quoting system and what the potential quotes come back at. So we have agreed to that. So brokers do not have to be an actual chamber member to receive a quote, but they do need to actually be a chamber member to actually place the sale. So there actually are two different chamber membership levels that are available. The entry level is the $1,500 Broker Member Choice Health Program. That includes all of the chamber benefits, as well as your ability to sell the employer group health insurance offering. Now, the second level, and it also includes standard chamber membership benefits to include visibility on promotional materials of the Chamber Choice Program and the chamber website. The second level is the Preferred Broker Member Chamber Choice Health Program at the $5,000 level. Tanya, if you can put up the rest of the bullet points for us. The preferred health insurance brokers offering this program are at that level. Access to one active member postal list per year of every member. Next bullet point, please, Tanya. Ability to post member-to-member deals on the Fox Cities Chamber website. Complimentary member 411 ads. That's 3 of those ads per year. Tanya, please put up all the bullet points. One written member spotlight per year, subject to availability and space. An opportunity to upgrade member spotlight feature as a video, 1 membership per year. And premier placement on all Chamber Choice materials and the Chamber website. So tremendous opportunity to show up on our website both ways and get visibility as a qualified broker for this program. So we will have additional information on those specific levels on the Fox Cities Chamber website. And after the questions and answers, we do have contact information for your contact at the Chamber as well. So, but at this point, Tanya, if you could help us with some of the questions that have been put into the chat box.
Sure thing. So one of the questions that we have is if a group wants to have Robin and Network, do they have to do separate submissions to each carrier as if they are applying for each one individually? So can we just cover that one more time for clarification?
Yeah, I can take that one. So yeah, so basically you're going to have to send in 2 submissions. You're going to have to send it to, for example, our new FC Chamber Choice at networkhealth.com inbox. And then you would send the same submission over to Robin HealthPartners as well.
That's correct. We may have slightly different requirements, so that is why we encourage you to go out on our respective websites and identify those documents.
Perfect. Thank you. And just this question has come through several times. I know we covered it in the slides, but we just want to clarify again. And Becky, you can probably adjust this one. Can you explain again the broker and client chamber membership requirements with the program?
Sure, absolutely. As far as our chamber members, irregardless of membership level, they do qualify for the Chamber Choice Insurance. So on our website, there will actually be a place where you can click and find out if they are a current member. So there will be an updated list that's available at all times. And then from the broker community, you have to be at one of the 2 broker levels to be able to actually sell the program. But to be able to do a quote, you do not need to be a member.
Perfect. Thank you so much. That one came through a couple of times. Just want to make sure that everybody understood that piece of it. We do have some more questions, so we'll keep moving forward here. And I think we kind of covered this as well, but again, the implementation, the service, the quoting, working with two carriers. You had mentioned that you would need to submit 2 separate quotes, but could we walk further into the process on in regards to that?
Travis, can you grab that one?
Yeah, so you're basically going to submit them to each of the carriers. You're going to get 2 separate quotes or proposals. And then the program is really going to be driven by the agent. So any communication you have in regards to the proposal you get needs to be directed at the carrier that is presenting that particular offer to you. So after the group is sold, you're going to have direct access to, at least on our end, to our dedicated client managers who will help with any implementation process that you might have, whether it's a PowerPoint presentation, in-person meetings. And obviously for those employees who sign up for Network Health, they're going to have full access to all of our customer service in our Menasha office, all of our care management, case management, and so forth. So it's really going to be driven at the end on which employees select which carrier. So.
Perfect. Thank you. Becky, this is probably more directed toward you, and I know we covered it pretty quickly, but maybe we could just touch on it a little bit more for clarification. The brokers that join at the 5,000 level, do they get any sort of priority in selling the program as opposed to those at the $1,500 level?
They will receive an additional list, a mailing list of all of the current members. Actually, on the slides that you will be receiving, it does highlight additional benefits, as well as when you go onto our website, you'll see the additional benefits. But their logo will be front and center and have premier placement on applicable chamber promotional, not only our website, but any promotional material we send out regarding the chamber choice.
Perfect. Thank you for that clarification. This is a good question, like math questions. Are we ready? If a group has 15 individuals, 9 of them would like to go with Robin, 6 of them would like to go with Network. Is that possible, or do you have to have 10 total enrolled on the Robin plan?
Yes, that's possible, and no, you do not need to have 10 enrolled. As long as in the Robin plan, we will allow that split below 10 between the carriers, but the minimum enrollment to use a Robin plan has to be 10 enrolled overall.
Excellent. Thank you, Lori. That's very helpful. Another question coming from April. For the 51 plus enrollment, is it possible to request a net of commissions?
Yes, for us.
Same with us, absolutely. Yep.
Okay. Just 1 second. I'm sorting them through because there's quite a few coming through. So the same submission to both carriers, or you have to determine who wants what with each carrier and only submit those employees to each carrier?
The same submission for both carriers with all the information on the group. The determination as to where they fall will come after quoting.
Okay.
Same with us.
Okay. So here's another one, more math questions. Let's say 15 employees sign up, but it's a 1 to 14 carrier mix. Will that one employee be allowed to keep their election?
Yes, for us.
Yes, for us as well. So.
Do you guys feel like you're being quizzed? Like,
Yeah.
So many math questions. Yeah.
I know, right? We weren't prepared for that. Did you say if you are a chamber member, you can enroll in the Network Health / Robin plan? So the answer to that is yes, obviously, if you're a chamber member. Question from Sharon, 2 to 9, the 2 to 9 size with Network Health plan is fully insured, but anything 2 to 50 with Robin would be level funded or underwritten?
We
The
don't.
2 to 9 space with Network Health is still level funded.
Okay.
We do not offer a group ACA plan. So with this program, 2 to 9 will be exclusive to Network Health, and then 10 to 50 will still be level funded, and that would then qualify for the dual choice option between the two carriers.
That's correct. We do not work in the 2 to 9 space with our level funded products.
Yeah, so the fully insured is going to come into place once you hit that 51 and above ATNI.
Okay, perfect, thank you. So underwritten by both carriers and rates won't change if only one employee takes Network Health and the rest take Robin?
That's correct.
That is correct, yeah.
Okay. Just want to make sure, just to kind of do a last call if anybody has questions. Somebody did ask about sending out the PowerPoint slides. We'll need to condense that down into probably something a little bit more manageable, because obviously the sizes of the PowerPoints are quite large, so being able to send those out to the group, but we will find a way to condense that information and get that out to everybody. But as we noted, the webinar is recorded and will be sent out to all participants, so you will have access to that after the fact. If there are other questions. Becky, this one would be geared toward you. If somebody's already a chamber member, their insurance agency is already a chamber member, do they now have to change to a broker level to be able to sell the program?
If it depends on the level that they're currently at, but yes, they would need to adjust to a broker level. So please just reach out to the chamber and we can help step you through that process.
Okay, and there was another question in regards to that as well, but we've covered it, I think, with that answer. So I think that's it. I don't see anything else for right now. Is there any other just comments or information or anything that Becky, you would like to share before we wrap up today?
Well, we just want to thank Network Health and Robin for all of the tremendous work and time that has been put into this program. Clearly, all three of our organizations are excited about the timing. We feel that this is really going to be a tremendous resource to our business community when so many of our businesses really can use an extra hand right now. So please, by all means, reach out to the chamber, reach out to Network, reach out to Robin with any questions or any help you may need. And we are excited to get this up and running in the next 30 days.
If I could just cut in for just 1 second. I'm sorry, I don't mean to take away from Travis and Lori. We'll get last comments from you as well. I did have one more question come in. Is there any difference in the rates through this chamber choice plan versus non-chamber choice plans?
I'll respond to that initially. There is no difference in the rates for the program, but there may be, you may see more aggressive pricing because of the fact that we're using our focused network option here. So using the focused network option, again, allows us to access our best discounts, and that's where it's coming from.
Thank you.
Yeah,
Travis?
I would agree with the same. So while there is no guaranteed discount that you can receive, the agents need to remember that this is driven by the agents. So if you need to go back to the carrier and make adjustments with, alternates or possible, rate relief, that you certainly do have that option of doing so once you get your proposal. So.
Okay. There was just a comment about having one brochure with both carriers on it. So that is something that we'll take into consideration. I know everybody's marketing departments have been working feverishly to put together a lot of different materials that we'll be sharing over the coming days and weeks. So we will be sharing a lot of information, and there will be more to come. And you can always watch the foxcitieschamber.com website for more information. So any last comments from Travis or Lori before we wrap up today?
No, thank you very much.
Thank you guys very, very much. Very excited.
Well,
Very excited.
One additional comment that we should make is that on Wednesday, there actually will be a webinar for chamber members. So that is why we brought the brokers together ahead of time, so that if you get the call, you're the first to get the information. So don't be surprised on Wednesday if you hear from some of our members regarding this program.
Perfect.
Perfect.
All right. Well, it sounds like everybody got a lot of information. We've had some good feedback already coming through, and just thank you to Lori and Travis for your time today. We appreciate you spending the afternoon with us, and we will see you again next week when we share this information with our member community. So with that being said, I will let everybody adjourn for the afternoon, and have a great day, and try to stay dry out there if possible.
Thank you so much.
That's good. Thank
Thank
you
you.
guys.
Bye-bye.